Sometimes, a baby that is breastfed may suddenly decide to refuse breastfeeding. The baby will pull away from the breast, then toss his head from side to side. This can happen at any time, so there really is no way to predict it happening. Refusal to feed from the breast could occur when the baby is in pain. Normally, this can be due to an ear infection, sore head from vacuum delivery, thrush in the baby's mouth, or teething. The use of dummies, teats or nipple shields may also contribute to refusal. Some babies actually find it difficult to feed from the breast and bottle as the sucking action is very different. Some become confused, therefore it's always best to avoid using any type of teats or dummies. Sometimes, the milk just tastes bitter. This can be due to antibiotics, if you starting or in the middle of your period, or nipple creams. If the milk tastes bitter, your baby will normally not want to feed. How solve the problem? First, you should always try to identify what may have caused the breast refusal, then begin to treat the cause. Always remain patient and gentle with your baby. Be sure to hold your baby next to you, skin to skin, so that he can take the breast when he wants to, so that he begins to realize that breastfeeding is both enjoyable and comfortable. Older babies may suddenly take shorter and fewer breast feeds, although this can be normal with some babies. Therefore, it's always best not to try and make the baby feed longer, but instead let the baby decide how often and also how long each individual feeding will last. Reasons to breastfeed. For many years, scientists have been playing out the ingredients that make breast milk the perfect food for babies. They've discovered today over 200 close compounds to fight infection, help the immune system mature, aid in digestion, and support brain growth, nature-made properties that science simply cannot copy. The important long-term benefits of breastfeeding include reduced risk of asthma, allergies, obesity, and some forms of childhood cancer. The more that scientists continue to learn, the better breast milk looks. In addition to making your baby healthier, breastfeeding may also make him smarter. Many studies have proved that breastfed babies tend to be more smarter than babies who were fed with formula or other methods. Breastfeeding does help with nutrients and the support of brain growth, which is something every mother should think about. The benefits for the nursing mom are just as good as they are for the baby. The hormones that are released during breastfeeding will curb blood loss post-delivery and help to shrink the uterus back to its normal size. Long-term, the breastfeeding mom will have a lower risk for premenopausal breast cancer, which is the kind that strikes before the age of 50. The benefits will begin to show with 3 to 6 months of breastfeeding and increase the longer that breastfeeding continues. By now, you should realize that breast milk is one power-packed liquid. It offers more for your baby than formula, or any other scientific creation for that matter. As you begin to plan for the future of your baby, make a commitment to breastfeeding him for as long as you possibly can, as it will do both your bodies good.